Hello friends, welcome to Radiology. Radiology is a very interesting subject that I hope all of you will like. It combines everything, it has every bit of surgery, medicine, pediatrics, gynecology, so it makes it a very interesting topic in itself. I hope you enjoy learning radiology with me as you go on this journey with me through various images. And I'll be starting with Introduction to Radiology, where I'll introduce to various imaging modalities that we use and what are the basic terminologies in radiology. The imaging modalities that we use in radiology. So what are the imaging modalities? They are basically divided into two types. Those that use ionizing radiations, and those that do not. So no radiations. So what are those imaging modalities which do not use any radiations? These are ultrasound and MRI. And which are the ones that use ionizing radiations? These are X-ray or radiographs, fluoroscopy, which again uses X-rays, digital subtraction angiography, CT scans, DEXA scans, and mammography. Okay. Now, what does DEXA stand for? Okay. So DEXA stands for DEXA stands for dual energy X-ray absorptiometry. Okay, dual energy X-ray absorptiometry is DEXA. What does DSA stand for? Digital subtraction angiography. Okay, so these also use X-rays. Now let's see the imaging modalities. So image 1 is an image of an ultrasound where we see various ultrasound probes. So we'll learn what are the types of ultrasound probes when we discuss ultrasound. The second image is that of a fluoroscopy. So the first was an ultrasound. The second is a fluoroscopy in which there is an X-ray beam and there is a detector. So what kind of fluoroscopy is this? This is a C-arm, where it is very commonly used in orthopedics and urology. Now image 3 is that of a CT scan. Okay, and what are the two modalities which are round in shape, donut type, CT scan and MRI. Okay, now how will you differentiate based on its image? So usually CT scan ka jo gantry, the gantry, we call this area the gantry, it is little thin as compared to MRI. So if this is the thickness of CT scan, you will see that the MRI gantry is very thick. It is very big gantry because a whole magnet has to come inside an MRI, right? And also in an MRI, you will see that there is a vent that is going from the machine in the roof, and that is a vent for quenching mechanism. So whenever we want to shut off the MRI immediately, suppose there is a metallic tray or a cylinder inside the MRI scanner and it is projecting, it's showing a projectile motion towards the patient, you want to shut down the MRI scanner immediately. And in that case, the helium gas that is present in the magnet forcefully escapes it through this vent. So MRI has a vent attached to the scanner. That's how you differentiate a CT scan and an MRI. So which is this fourth image? This is a DEXA scan. Okay, this is a DEXA scan. And now what is this fifth image? This is a radiography unit. A normal unit through which we take X-rays. Now, which is this image? This is a DSA, digital subtraction angiography image, and this is a DSA suite. Where we do a lot of interventional procedures. For example, embolization. For stroke, we do thrombectomies. For peripheral artery, we do angioplasties. All these are done in digital angiography suites. Image 7, I already discussed. This is an MRI. And image 8, now what is this image? This is a mammography unit. Okay, so these are the basic modalities used in radiology. Now coming to the various terminologies that we use in radiology. So radiology mein everything looks either black or white. So we deal with 50 shades of gray. So either one thing is very black or one thing is very bright, and there are a lot of shades in between. So less black, more white, more white. So based on these terminologies, we have put in some words based on each and every modality. So anything which is black, we call it hypo. And anything which is white, we call it hyper. Okay. And then there is a suffix that is attached to either hypo or hyper depending upon what kind of modality we are using. So if we are using ultrasound, the suffix will be echoic. So anything which is black on ultrasound will be hypoechoic, right? So this is a black lesion in the liver. So liver appears slightly brighter than the lesion, or the lesion is appearing blacker to the normal liver parenchyma. Hence we call it a hypoechoic lesion. So any lesion which appears brighter than the surrounding parenchyma on ultrasound, how would we name it? Hyper, because it is bright, and since it's an ultrasound, echoic, right? Now, what is the suffix used in CT? It is dense. So anything which appears blacker on CT will be hypodense, and anything whiter on CT will be hyperdense. Okay. So for example, in this NCCT head image, so this is an axial NCCT head image because the bones are white. Because the bones are white, so it is an NCCT, so CT scan image. And here we see this lesion which appears blacker than the normal surrounding brain parenchyma. So it will be hypodense. This lesion is hypodense. And in this image, second image, we see that there is a bleed in the frontal region which appears brighter than the surrounding parenchyma. So it is hyperdense. Fine. Now what is the suffix we use in MRI? It is intense. Intense. So anything which is black on MRI will be hypointense, and bright hyper intense, right? Hyper intense. So for example, in this image here, we see that there is a bright lesion in the brain as compared to the surrounding parenchyma. So this will be hyper intense lesions. And here again in the second image, we see that there is a lesion which is darker than the surrounding parenchyma. So this is a hypo-intense lesion. I've deliberately switched hypo and hyper so that you don't mug it up, you understand what I'm telling you. Now, X-rays, the term is slightly different and slightly different altogether. For black things on X-ray, we use the term lucent. Okay, and for white things on X-ray, we use the term opaque. And what is the suffix in X-ray? It is radio. So anything blacker on X-ray, for example, this is the normal lung, and this area on the right lung we see it is more black. So it will be called radiolucent area in the right lung. Similarly, on the second image, we see that there is a brighter area on the right lung as compared to the left lung. So we'll call it radio opaque. Okay, so I hope this was clear. For X-rays, radiolucent or radio opaque. For ultrasound, the suffix is echoic. For CT, the suffix is dense, and MRI intense, right?